Imagine being 70 years old. You walk into your room and you forget why you came. You forget where you left your keys. You forget the name. And this is Alzheimer's disease. A recent research published in the American Journal of Medicine shows something very important. And today we're going to talk about it together. So if you want to read the paper for more details, you can see the link in the description. So researchers are increasingly finding that cognitive decline is not all about age. It's also connected to how we live, how much we move, how we eat, how we sleep, whether we isolate ourselves, whether we control problems like high blood pressure, diabetes, obesity, physical inactivity, depression, and other conditions that quietly affect the brain. In fact, some researchers now estimate that up to 45% of dementia risk may be linked to factors we may actually modify. Think about it for a second. 45%, almost half. So this is not because aging disappears, not because Alzheimer's suddenly becomes easy, but because the brain is affected by much more than we used to think. And what makes this even more interesting is that researchers didn't just sit down and make theories. Large studies followed older adults who were at risk for cognitive decline. So what they realized that is the people who followed structured lifestyle programs, including physical activity, healthier eating, social engagement, mental stimulations, and better health monitoring showed improvement in cognition. That is important because for years, many people believe that once brain decline starts, there is very little you can do. Now, we are learning something different. The brain may be more responsive than we thought. Not perfect, not invincible, but responsive. And honestly, this should change the way we think about the brain health. Many people start worrying about Alzheimer at 70, but maybe brain protection starts much earlier. Maybe it starts when we decide to take a walk instead of spending the entire day sitting. Maybe it starts when we finally control our blood pressure. Maybe it starts when we stop treating sleep as something unimportant. Maybe it starts when we reconnect with people instead of living in isolation. And maybe it starts when we challenge the brain instead of putting it autopilot every day. The reality is that nobody can promise you that you will never develop Alzheimer's disease. But what this research tells us is something powerful. The choices we make today may influence how our brain functions years from now. And that is the message worth paying attention to, because protecting the brain shouldn't begin after memory is already disappearing. It should begin while we still have the opportunity to protect it. And that is exactly why conversations like this matter. So, don't forget this. Your daily habits may affect your brain years from now.